They talk about the NHS in terms of it being in crisis so often, don't they? £30 billion deficit, nearly £2 billion of that going on temporary staff, as we heard. And, of course, we're all living longer, which is putting pressure on the service. But it's, despite that, still enjoying its second highest approval rating in its 67-year history. Well, for 3 days, managers and bosses are in Liverpool for their annual conference. Mark Gay has been along today to see what it was all about.
Hello, well, welcome to the Convention Centre here in Liverpool. This is the biggest conference of its type for the NHS Confederation, which is all basically the managers, the people who spend the money in the NHS. More than 3,000 delegates are here, and today they've heard speeches from the chief executive of this organisation and also the chief executive of NHS England. With me now is Catherine Sheeran, who is in charge of the clinical commissioning groups, basically spending a lot more money here in Liverpool. You've heard today about there's going to be no more money to be spent. The government certainly not going to pump any more money in this year. How's that going to affect what you do here in Liverpool?
Hi Mark. Well, in Liverpool we've got a great plan for how we want to reorganise health services locally. A big thing for us is about prevention, and we're working really closely with the local authority to look at how people can become more physically active. But then we also want to get primary and community and social care services working in a different way, and then to get hospital services working in the best way possible. Now, we spend a lot of money in Liverpool on the NHS, so what we need to do is make sure we're spending it in the right way, and the more we can spend on prevention and the more we can spend on primary care means that we're keeping people well, keeping people fitter, so we don't need the more expensive services in hospital, and that's how we think we can cope with the financial problems that we'll be facing in the future.
One of the speeches today said in the NHS, that big word H, health, and here on Merseyside we do have above average instances of people with lung disease, heart disease, through lifestyle, drinking, smoking, etc. So is that really the big key to it now? You want to keep people out of hospital, and they can, or we can all do that ourselves by just changing our lifestyle or modifying our lifestyles.
I think that what we heard today was right, in that the whole country needs to really think about health and how we as individuals and as families and as communities keep ourselves healthy. And part of that, we believe, is about physical activity. And there is really strong evidence for how if people take more physical activity, and we don't mean necessarily sport, we mean maybe walking or gardening or some of the more gentle physical activity, that this will make a big impact on health and on health outcomes and on how much we need to spend on expensive treatments in the NHS.
Now, we talk about money. Now, one of the hospitals which is dear to lots of people's hearts, Liverpool Women's, we've heard the last few months or so, they are really suffering. They have a big deficit. There's talk the hospital may either have to close, move, merge. How bad is the situation there, or are they just sort of over-dramatising the effect?
I think there are some real issues in terms of our hospital services in the city, and the Women's Hospital have been very open with their staff, with the patients and with the public about the issues that they're facing, which is very similar to other hospitals in the country. I think, though, what the Liverpool Women's Hospital have done is work very closely with the staff, with the clinicians, and talking to their patients to explain what the problems are, to understand the problems and come up with the solutions. And they've really focused on solutions which make better sense in terms of services for patients as well as sorting the money out. So how can we get the best services for patients in the future?
We also heard today that the cost of litigation, either being insured or so that you don't get ruined by a legal settlement if something goes wrong. Now, at all conferences or exhibitions, the biggest exhibitors here are the law firms. Now, they wouldn't be here unless they saw big money in insuring or signing agreements with people such as yourselves or the individual trusts. Do you think it's gone too far now, how much some of these settlements are? Or is it really a case that the clinicians should be more careful when they're making diagnoses or carrying out operations?
Well, obviously we want to have the best care given to patients, and we don't want mistakes to happen. We don't want to be in a position where we have to pay out big settlements to individuals, because obviously individuals don't want things to go wrong when they receive care. So the really important goal for us is to make sure that we've got those best services possible, that we've got the right quality, we've got the right number of staff, we've got staff trained to the best of their abilities, and we've got services which operate in the best way for patients.
Because we heard today from a GP in Derbyshire, but that probably is replicated all over the country, that around this time of year when out-of-hours doctors get their quotes, they're almost crippling how much money they have to spend.
Yes, that's right. There's a big issue which has emerged really in the last few years about the indemnity costs for GPs that we do need to look at, and we do need to make sure that the services that we've got are affordable going forward, and that we kind of, I suppose, tackle this collectively as the NHS, and that we can work together to make sure we're getting best value in terms of indemnity costs and other costs actually that we face in the NHS.